Here in Hawaii, we are facing a growing population of people who are over the age of 65. That gap is getting bigger and bigger. And by 2035, we're going to have close to 380,000 people who are over the age of 65 just on the island of Oahu alone. This creates a massive gap in our healthcare system because people want to age in place. People want to have access to affordable healthcare. And it's already very difficult in 2026 to get these types of appointments. Imagine what's going to happen when there are 180,000 more people trying to access primary care, especially high needs primary care on Oahu. So it's important for us to step in and fill this gap. We've been doing this for 47 years. We have deep roots in our community, and we've cared for pretty much everybody's family here on the island of Oahu. We are mission driven, which means we will do the right thing at the right time for every patient. It doesn't matter if we're going to get paid. Our keiki program at Navian Hawaii is very special to us. When I took over as CEO 2 years ago, we had a small panel of patients, about 7 kids, medically fragile, concurrent care kids who are both terminally ill and also seeking aggressive treatment. I knew immediately that we wanted to make significant investments in this program. We have increased our staffing, we've increased awareness, and because of that, we now have about 50 total kids and their families who are under our umbrella with both hospice concurrent care program and with our palliative care program. Kapiolani Children's Hospital is busting at the seams with kids who are unable to go home because there are not high needs medical professionals who can go to their homes to provide this care. There are instances of some keiki who live in the hospital and have lived there for years because there's not a community-based model that can allow them to go home and allow their families to care for them with the support of a program like ours. And we are now working with Kapiolani and other partners to figure out how we can get more of these kids out of the hospital and get them home so that they can live normal lives and go to school and see their friends. One of the biggest myths about hospice care is that when you decide to go to hospice, you're giving up hope. Deciding to enroll in hospice is not about giving up hope. It's about placing your hope in something different. It's about placing your hope in an exceptional end-of-life experience and getting to spend more time with family and friends when you feel well. It's about placing hope in quality of life, not quantity of life. So if what you heard excites you to get involved with what we're doing, there's a few avenues. First, we always need people to give of their time. We have a lot of volunteer opportunities here at Navian Hawaii to really give back to the community through whether it's patient presence or coming into our office and doing administrative work. There are lots of opportunities to volunteer. If you prefer to give financially, we have lots of different ways that works. We have monthly giving initiatives. There are some annual giving type of things that are available. Even the smallest gift goes toward programs like our keiki program or our bereavement program. We also have big capital investments that we need in order to drive our residential care expansion. We're building a new hospice inpatient unit. Based on donations that were given to us, it's going to open 5 new affordable beds for kupuna who are dying to be able to spend their final weeks. We want to be able to expand that to further residential care homes across the state. We thank you for your support, and we look forward to joining together to make even more of an impact in 2026 and beyond.